Hi, my name is Melissa McGinnis. I have a condition called essential tremor that I guess you could say is in remission at this point. I don't really know what the exact terminology that I should be using would be, but we'll just say that it's basically in remission at this time. I've had two procedures from Insight Tech called Focused Ultrasound, performed first on the left brain, right body, and then just most recently, the 10th of October, on right brain, left body. And so, not shaking, I'm nice and steady. I can do things like put my hands together, put lids on things, all kinds of crazy stuff that I've never been able to do, really, not in one fell swoop. And my writing is so much better. It's ridiculous. I can read what I write after I write it. And side effects. Excuse me. So, I'm done with the steroids. I do not like steroids. They are not my friend. I didn't have really any emotional outbursts. Well, I had two little fit throwing tantrums. And then other than that, we're kind of just getting out of it. It's been a few days and now I'm like starving to death and want to eat everything. And hopefully that will pass just in a couple of days. I don't know if you're supposed to be doing that whenever you're on them. They don't really make me want to eat. They make me want to eat afterwards and then whatever. But I don't like them. I don't want to take them. That is the worst part of the entire procedure, is taking the steroids for 2 weeks afterwards. So that's the time frame. Last time it just seemed to keep going because I didn't have a handy dandy little check off the date chart. So it was just like endless days of steroids that I never thought would go away because I couldn't count pills effectively. It was just losing my mind being on these ridiculous drugs. But it's 2 weeks and so I'm off of them and feeling better, and feeling like I have energy, so that's good. I am experiencing a numb tongue, so apparently some of the side effects that you can experience, this is more with the second time around. The second procedure would be that your tongue goes numb, that taste is off, things like that. So I am experiencing the numbness on my tongue. It's just slight. It's not ridiculous. Like I'm not having problems where my tongue feels like it's super big and thick and in my way in my mouth and I can't, like I just had dental work or something. It's not like that. Just pretty subtle, just kind of little tingly numbness going on. And then things like cottage cheese have tasted kind of weird. Nothing too substantial. It's been when foods are cold, like colder or hotter, they seem to taste weirder. So everything needs to be like a nice warm, neutral temperature, I guess, whatever. But so there's that. That's going on. That may continue after healing and everything. I don't know. Right now, I'm just going to say it's temporary, and then if it continues, whatever it does, it's not any sort of big hang up or any kind of issue. So it's not really doing anything. It's just there, a thing that's happening that was different than before. So there's that. Once I had the procedure, I did have slight dizziness for about 2 weeks where I just kind of felt like foggy, lightheaded, just dizzy kind of feeling. Pretty subtle, nothing to where I was like, I'm going to fall over or anything like that. But just a mild dizzy feeling. So that has gone away. I'm not having any kind of issue like that. I was also wobbling, so my balance issues are common as a side effect because your brain swells and it messes with the movement areas in your brain, whatever, hits different things and makes you act all different than what you would normally do while it's settling back in place. So The first time around, I did have balance issues where stepping was not right, and running into walls, which my dad also had the same thing where he was running into walls too. And but that goes away. And then with this one, it's more like a wobbly kind of thing is what I was experiencing. Kind of went along with that dizziness. No missteps, no falling down, no none of that like I did have the first time around. So there's that. And I have used my cane. I'm not really using it anymore unless I'm going out walking like a long ways or something, and then I'm still carrying it. But I have not needed it at all. Whereas last time there were several points where if I didn't have my cane, I would have fallen down. So not that I haven't fallen down since then, because I did run smack dab right into a tree when I was outside playing with my dog. Had nothing to do with anything other than I wasn't paying attention to where I was going. So not side effect related. So yeah, definitely needed the cane more the first time. My brain seems to be accommodating this one better. Last time, it's like my right side was confused by not shaking, and so it would activate my left side. So even though my right hand is dominant, I would just start grabbing and doing things with my left hand because my body knew how to compute shaking and didn't really know how to function my right hand without shaking. So now neither one is shaking, and it's wonderful, and I'm just doing things with whatever. Okay, did I say burned myself? I don't know. If I said it on this one, I had to re-record because I wasn't recording, so I didn't really say it on another recording. I just thought I did. I burned myself with an iron. Oops. Pay attention. So that's what that bandage is for, should you wonder. And then other than that, that's really all of the side effects that I've had this time around, so which is fantastic. And way easier than the first time around. Obviously, I knew what to expect. The first time around was easy, but it was a bunch of unknowns. It's kind of you're just walking into this thing of, I don't even know what to do. I'll tell you what, I would do that procedure every month if I had to. Probably really not, because that's a lot. But if I had to do it again, I wouldn't hesitate to do whatever. It's not any big deal. Oh, but then you have to take the steroids. The steroids are the worst part. I'm telling you, they're the worst part. So, but I would easily do it again. I would highly recommend it to anyone considering it. If you have a movement disorder, if you have a central tremor, there's a variety of things that they're using focused ultrasound now to treat. Parkinson's is one of the things. And then, of course, a central tremor, depression, I've heard. I don't know anything about that, so I may just be talking. But I think that that's a thing. So you may want to look that up. Don't listen to me. I just know about it for a central tremor. Anyway, I would highly recommend it. It's non-invasive. The deep brain stimulation surgery that previously was pretty much the only surgery procedure that you could do that was effective does require cutting in, does require wires being placed in, does require that pacemaker being implanted. This has none of that. And my understanding is that you can always go back, and should I need to do deep brain stimulation later on down the road, that is always an option. Hopefully this holds. Every brain is different. Every body is different. Everyone functions and does the procedure differently. So I don't know what the future will hold. I just know that right now it's working amazing, and I'm in love with the results, and so grateful that I did the procedure, and so grateful to my team at OU Medical because they were wonderful. Dr. Connor's fantastic, and his whole team is wonderful. Mickey, all of them, super fantastic people. Walk you right through everything and make you feel nice and comfortable, answer all of your questions, and it's just really great. I highly recommend that you look into it and just keep walking forward with the process until You're the one who is going, yes, I want to do this next month or whatever the case is. Just keep going, learn everything you can about it, figure out if it's right for you. There's lots of options out there for treatment for essential tremor. If you're one of the people who has luck with medications, then high five, great, that's wonderful. If not, like so many people, and you are looking for a solution because your shaking is so bad that you are not able to have any quality of life, which is what happens. But despite the fact that it's not considered a disability, it is a disability. It's debilitating. You can't function. I don't care what anybody who's paid $36,000 a year to tell me no 1.5 million times says. It's actually a disability, period, end of story. It's not up for discussion. So if it is murdering the quality of life that you have, and you can't do anything for yourself, look into this procedure, because that's gonna be really helpful if you qualify for it and have amazing results. So, which most people do. It's a slim percentage of people who don't feel changes, or don't experience changes, or have any kind of bad side effects that would make them not want to do the procedure again. That's my understanding. Obviously, for me, it's been successful. But do your own research and find out for yourself. So thank you so much to everyone who is following along with me. I love you. I love yours. You guys are wonderful. Be nice to each other. Look up the word understanding, nice, all those things, redefine them. Nobody knows what those things mean. They just make up stuff and act like it's real. Blah, blah, blah. So many other subjects. But love you. Be nice to people. Thank you for tuning in. Check out my other videos. Hit subscribe. I will, I'm sure, come back with something a little bit later. My dad and I are supposed to probably do some kind of something, so maybe that will end up being a video post or a post or something. Blah, blah, blah. I'm just going to ramble here. And okay. Thank you for tuning in, and love you. Have a great evening. Bye. Day, whatever, whenever it is. Okay, bye.